When we look at the reported cases and the data is in front of us, there is no need to create panic. Our numbers for upper respiratory tract infection and gastrointestinal infections at this particular time is below the normal value, but we're constantly watching. And so these voice notes to create concern and panic, I don't think it's appropriate.
Health Minister Dr. Michael Darville coming to the defense tonight following claims by opposition officials that government is not being transparent with the public on upper respiratory cases.
Did you know that across the Bahamas for the last few weeks, we have seen an upsurge in respiratory illnesses affecting adults, infants, and children? And yet, despite this huge upsurge, very little information has been provided for parents to protect their children.
That's chairman of the Free National Movement, Dr. Dwayne Sands, and he's claiming that this is resulting in local health facilities being on the verge of collapse.
So many children have been impacted that emergency rooms, clinics, and doctors' offices have been inundated with children with severe respiratory and gastrointestinal complaints. A number of children have required hospitalization, some in the ICU. And sadly, you've heard nothing about this from your government.
In fact, Sands says it's now having a trickle effect.
Over-the-counter and prescription medications such as Tylenol, Panadol, cough medicines, Ventolin, and other drugs are dwindling, and in some instances completely out of stock across the Bahamas. Pediatricians are overwhelmed. These viral syndromes are protracted and often leave their patients debilitated with chronic symptoms that last for weeks.
But the health minister maintains that this is nothing new.
At this particular time of the year, we do see spikes of upper respiratory tract infections and some indications of gastrointestinal. Most of them are viral. It happens every year. You must realize that we came out of a COVID pandemic, and so during that particular time, everyone was mandated to wear masks. And so now we're being exposed. And so, but I want to report to the community that the numbers are below the normal value.
That said, here's his admonishment to the former health minister.
Dr. Sands has something or some information that he knows about that our ministry is unaware of. He needs to bring it to my attention rather than create panic in the community.
Jose Etienne, Eyewitness News.